It's one of the deadliest cancers. A vast majority diagnosed with pancreatic cancer will die from the disease.
Here to talk about a symposium aimed at demystifying this killer is Mary Ellen Smith from the Pancreatic Association of Western New York and Dr. Vivek Kaul, a URMC doctor who specializes in pancreatic cancer, gastroenterology, hepatology. Thank you both so much for being here.
Good morning. Thank you.
This is, we say it's one of the deadliest because I think out of the 46 or 47,000 who are diagnosed, it's like 39,000 will actually die from this disease. That is just an incredible number.
That is correct. Of all the cancers, and particularly all the diseases that we encounter, we look at what we call the case fatality rate. That means how many people who are diagnosed with the disease will actually ultimately die from it. And pancreatic cancer is one of the highest case fatality rates. In fact, almost not all, but most people who are diagnosed with it will ultimately succumb to it. And that's the unfortunate part.
And you, I know, Mary Ellen, you've been working for years to get people to pay attention to symptoms, but the difficulty is that these symptoms can often mimic other things, right?
Right, and that's why we call it the silent killer, because it does mimic so many other digestive disorders that it's hard to detect until the late stages, which then affects your mortality rate.
Interesting. And so you're holding a symposium, and what's the purpose? You say demystifying. What is there to demystify about this disease?
I think basically, like many diseases out there, what we know based on science and what we actually end up doing for managing that condition sometimes is not fully communicated or made available to the public at large. Especially the patients and families come in with some misconceptions, myths, and other anxieties related to the condition. And because it's such a deadly disease, there's this general kind of a thinking out there that this is a death sentence. However, over the last few decades, many advances have been made in the realm of managing pancreatic cancer, and I think the idea that the group had was to have a one-on-one meeting with patients, families, other community members who are maybe care providers, who can be updated as to what are the things that we can do to diagnose it early, how we can lower the threshold for awareness, and get to more optimal management in a timely fashion. The buzzword nowadays in cancer management is multidisciplinary care, which means the cancer doctors, the surgeons, the endoscopists, they all work together and they come to a consensus on how best to manage a patient. So a lot to dispel the misconceptions and also to educate the public. I think it's a very, very novel effort in that regard and should be replicated in many other diseases as well.
And this is a free symposium.
It is free. We have some wonderful sponsors with Actavis, is a pharmaceutical company, and the UR Medicine Center's Wilmot Cancer Institute have generously underwritten the cost so that we can provide it free, so that more people can understand this disease and get the awareness increased.
And when and where is it for people who might want to come?
It is next Saturday, January 24th, at the Wilmot Cancer Institute's Alumni and Advancement Center at 300 East River Road, and it runs from 9 to 12:30, registration at 9 with a continental breakfast.
That's great and wonderful. The more knowledge, the better in this situation, especially since it is one of those cancers that we hear about, and unfortunately we often hear the end result is not is not pleasant.
And it'll be a unique opportunity for attendees to actually be one-on-one with experts in the field, surgeons, endoscopists, cancer doctors, researchers, and it'll be a closed-door kind of a one-to-one discussion, and that's pretty unique.
Knowledge is power, they say, and we certainly mean that in this case. Thank you so much. We appreciate it.
Thanks very much.
All right. When we come back, weather, traffic, local headlines.